I agree, Greg. I cannot emphasize enough how important this multidisciplinary care is. And it might look too much laboring for the families, but I think it is critical. And we've known that this multidisciplinary care have helped in, slowing down the progression of the disease as well. I always find it interesting when you see these boys, what's our goals of treatment? This is not, it's a heterogeneous population, meaning you're not always seeing the boys at the diagnosis, right? So I'm sure you have boys coming in, followed somewhere else, coming into you, and there are boys who are late ambulatory, who are non-ambulatory. So your thought process of how do you set the treatment goals for these boys now that we have, in addition to steroids, more treatments like you mentioned is on the pipeline?
Yeah, that I do like thinking about it the way you're describing in terms of phases, and an easy way to think about it is the early ambulatory phase and the late ambulatory phase. So, we're talking about the 5-year-old boys in the early ambulatory phase and the roughly 10-year-old boys in the late ambulatory phase. And once boys transition to needing a wheelchair, then which is as best we're trying to make that into the later teens, but it still is in the earlier teenage years and sometimes earlier than that. But they're still able to sit very easily and raise their arms over their head, and they don't have a lot of scoliosis and they don't have a lot of breathing difficulties. We call that the early non-ambulatory. And then the later non-ambulatory is when they're having more issues with breathing, scoliosis, and decreased function in the arms, so that their movements are more limited to hand use and more difficulty feeding themselves or performing self-care. And we would call that a late ambulatory phase. And as boys move through these different phases, they need more pulmonary support, they need more nutritional and gastrointestinal support, and they can develop cardiomyopathy, which also can be managed.